All right, everyone, get ready because today we're taking a deep dive into the world of biopsies,
Ooh, biopsies.
specifically how they're used
Right.
to diagnose bone and soft tissue tumors.
Okay.
I think that word biopsy can
Yeah.
be kind of scary, especially when you're dealing with a possible tumor diagnosis.
Absolutely.
But really understanding biopsies and why they're so important
Yes.
can make a huge difference in your journey.
It can. It can. It's kind of like,
Yeah.
think of it like a map and a compass when you're in kind of uncharted territory.
Ooh, I like that.
Imaging, like X-rays and CT scans and MRIs, they're like the map giving us the lay of the land.
Right.
But the biopsy, that's our compass.
Okay.
It gives us the precise direction and confirmation we need.
So it's not just about knowing that something's there.
Right.
It's about understanding exactly what we're dealing with.
Exactly. Exactly.
Okay.
So imagine you're like an archaeologist and you just dug up some mysterious artifact.
Right.
You can see the shape and size from the outside. Okay.
But you wouldn't understand its true significance until you looked at what it's made of, right?
That makes sense.
Yeah.
Are there ever times, though, when you wouldn't need a biopsy?
There are some exceptions.
Okay.
One that comes to mind is osteoid osteoma.
Okay.
And this is a benign bone tumor
Uh-huh.
that looks so unique on imaging
Oh, interesting.
that you don't even need a biopsy.
So it's like what, the Eiffel Tower of bone tumors?
Yeah, pretty much.
You just know what it is just by looking.
You got it.
Wow.
But in most cases, a biopsy is really, really crucial,
Okay.
especially after you've done that initial imaging.
Right. So you've got the map. Now you need that compass.
Exactly. You need to
Need that.
confirm what you're seeing.
Exactly.
Now, think of the biopsy
Okay.
as like the bridge between the diagnosis and the treatment.
Okay.
It's not just about, do you have a tumor, yes or no?
Right.
It's about what kind of tumor,
Yeah.
what grade is this tumor?
Yeah, okay.
So it helps to really guide the entire treatment plan. So it's like laying the foundation for everything that comes next.
Exactly.
Yeah.
And that's why it's so important to
Yeah.
have this biopsy done at the same place where you're going to get your treatment.
Oh.
Think of it as a team of experts all under one roof,
Okay.
sharing their knowledge and experience
Right.
to come up with the best strategy for you.
So it's not just about convenience.
Yeah.
It's about that consistency of care.
Exactly.
Oh.
Having everyone on the same page leads to better communication, more coordinated care, and better outcomes.
That makes sense.
All right, so let's talk about the different types of biopsies now.
Okay, let's do it.
One that you might have heard of is FNC,
Okay.
or fine needle aspiration cytology.
I gotta say, I was surprised to learn that this one isn't used as often as I thought it would be.
Yeah.
It seems pretty simple, right?
Right.
You're using a thin needle to take out some cells.
Right. But,
Why isn't it used all the time?
well, you see, while FNAC is really minimally invasive,
Okay.
it has limitations.
Yeah.
It only takes out cells, not tissue.
Oh.
And that can make it less accurate.
So you wouldn't get the full picture.
Exactly.
Okay.
So in many cases, a core needle biopsy is considered the gold standard.
Core needle biopsy.
Yes.
Okay.
This uses a slightly larger needle
Okay.
called a Jamshidi needle.
A Jamshidi needle.
Yes.
Interesting.
And it takes out a small sample of tissue.
Okay, so it's a little bit more intense sounding.
It might sound that way,
Oh, yeah.
but it's actually really efficient.
Okay.
They use image guidance like ultrasound or CT scans
Mm-hmm.
to make sure they're in the right spot.
Like a GPS.
Exactly. Pinpoint the location on a map.
Okay, so it's more targeted and precise.
Exactly.
Right.
And it's minimally invasive.
Okay,
You can often go home the same day.
nice. A daycare procedure.
That's it.
Okay, but what about the more complex situations?
Yeah.
Are there times when a core needle biopsy just isn't enough?
You're right. Sometimes we have to do something called an open biopsy.
Open biopsy.
Yes. Okay. This means they actually make a small incision
Okay.
to get to the tumor
Okay.
and take out a bigger piece of tissue.
I have to admit, open biopsy sounds a little bit more concerning.
Yeah, it's understandable to feel that way.
Yeah.
But if an open biopsy is being recommended,
Okay.
it's because your medical team thinks it's the best way to get a good diagnosis
All right.
and to get all the information they need.
Okay.
And while it is a little bit more invasive,
Yeah.
it allows surgeons to take out a larger and more comprehensive sample.
So it's kind of like a wire lens view
That's a great way to put it.
versus the more targeted approach of a core needle.
Exactly.
Got it.
And that can be crucial for some types of tumors.
Yeah, that makes sense.
So it's all about getting a clear picture
Right.
to plan the most effective treatment.
Right.
Now, with any surgery, there are risks,
Sure.
but the surgeons take a lot of precautions to minimize those risks.
All right.
They pick where to make the incision very carefully. They'll use a tourniquet to stop the bleeding,
Okay.
and they carefully control any bleeding during the procedure.
Right.
It's all about achieving what we call hemostasis,
Okay.
which basically means making sure there's no bleeding
Right.
in the area where they're working.
Okay.
So you mentioned frozen section earlier.
Yeah.
That's a really cool technique.
I thought it sounded interesting.
Yeah.
Tell me more.
So imagine having a tiny lab
Right.
right in the operating room. It's like getting instant feedback
Okay.
on what the tumor looks like.
So during surgery, they can get real-time information.
Yeah, while they're operating.
Wow, that's incredible.
For example, we use it to make sure they got all the tumor out.
Oh, okay.
You know, what we call clear margins.
Right.
This is super important
Right.
to keep the tumor from growing back.
Gotcha. Okay.
So you've got all these different types of biopsies.
Yeah, is there a best one?
Well, it really depends on a bunch of things.
Oh, okay.
The type of tumor, the location, the size, your overall health.
Okay.
It's really a case-by-case basis.
So it sounds like those conversations with your healthcare team are really important
Oh, absolutely.
to figure out what's best for you.
Exactly.
Okay, good to know.
They'll consider all these factors
Mm-hmm.
and help you decide
Okay.
what's right for you.
That's good to know.
Yeah.
Knowing you have a team of experts guiding you through those decisions
Yeah.
can make the process a little less scary.
Absolutely, it can. It
Yeah.
can.
Good stuff.
Good stuff. One of the things that I find people get anxious about is waiting for the results.
Oh, absolutely.
It's understandable.
Waiting for any kind of medical results can be nerve-wracking,
Yeah,
especially when it's something like a tumor.
exactly.
How long does it usually take to get those results?
Usually it's about 3 to 4 days.
Okay.
For the pathologist,
Yeah.
the specialist who looks at the tissue, to look at it and give us a diagnosis.
Okay.
But sometimes they need to do some extra tests.
Okay, so it's not always a quick turnaround.
Right.
What kind of extra tests are there?
One of the ones that we do is called immunohistochemistry.
Immunohistochemistry.
Yeah, it's a big word.
It is.
But what they do is they
Yeah.
use special dyes to look for markers
Okay.
in the tumor cells.
Interesting.
And these markers can tell us
Yeah.
what kind of tumor it is
Okay.
and how it might behave.
So it's like getting a more refined, like a closer look at the tumor.
Exactly. A
Yeah.
much clearer picture.
Gotcha.
But those tests might take a few extra days.
So we could be talking a week or more.
Potentially.
I could see how that would be tough for people.
It is.
Do you have any advice for people who are waiting?
The biggest thing is to talk to your doctor.
Yeah.
Keep that communication open.
Okay.
Don't be afraid to ask any questions.
Right.
They're there to support you.
Right.
And sometimes just talking about it
Yeah.
helps
For sure.
reduce the anxiety.
Yeah. It's easy to feel like you're bothering them or something, but they really are there to help you
They are.
and feel comfortable and informed.
Exactly.
Okay. That's good to know.
It is.
It's good to remind people of that.
Yes, it is.
And finding healthy ways to manage your stress,
Oh, absolutely.
whether it's talking to a therapist, practicing mindfulness, or doing things you enjoy.
Yes.
It's just as important as your physical health.
You got it.
Okay, good stuff.
Good stuff.
Well, speaking of things that might cause some anxiety,
Yeah.
let's talk about complications.
Oh, yes. Complications.
Is that something that you find patients are worried about?
It's understandable.
Yeah, I think I would be.
Yeah.
What are some of the things that could happen?
Well, the good news is
Right.
complications are pretty rare,
Okay.
especially when the biopsy is done by a good team at a specialized center.
Okay, that's good to know.
It is.
But I'm still curious, like, what are some things that could happen?
Okay, so like anytime we break the skin,
Yeah.
there's a chance of infection.
Okay, right.
You could have some bleeding,
Yeah.
maybe some pain
Okay.
after the procedure,
Yeah.
but that's usually managed
Okay.
with some medication
Okay.
and good care.
Yeah.
In very, very rare cases,
Yeah.
you could have a fracture,
Oh, wow.
but that's only if the bone is already weak from the tumor.
So it sounds like the benefits of the biopsy probably outweigh those risks.
In most cases.
Yeah.
Definitely.
The information is just so valuable
It is.
to get that diagnosis
Yeah.
and figure out the treatment plan.
It's all about making good decisions
Right.
based on good information.
And that brings us back to what we were talking about before.
Yes.
About having the biopsy done
Right.
at the same place you're going to have your treatment.
Exactly.
Because if you need surgery or other treatment,
Right.
you want the same team involved.
Yes.
Right.
It's like this,
Yeah.
the team who did the biopsy,
Yeah.
they know your tumor.
Right.
They've seen it up close.
Right.
They know what it's made of.
Exactly.
So they're in the best position
Sure.
to figure out the best treatment
Right.
Having everyone on the same page,
Yeah.
from the pathologist who looked at the sample
Yes.
to the surgeon who might operate,
Yeah.
really make sure everyone's working together.
It's like having an orchestra and everyone's playing from the same sheet music.
It's a great way to put it.
Everyone's in sync.
It is about working together
Yeah.
to get you the best possible outcome.
Yeah, I like that.
So what's the most important thing for our listeners to remember today?
Ooh, good question.
Yeah.
The big takeaway.
The big takeaway.
I would say it's that a biopsy,
Yes.
even though it might seem scary,
you can.
is really about giving you power.
That's right.
Power through knowledge, power through understanding your diagnosis.
Exactly.
And taking control of your health.
Exactly.
It's about turning that fear of the unknown
Right.
into something that you can understand and manage.
Exactly. And remember,
Yeah,
you're not alone in this.
that's so important.
You have this team of healthcare professionals who are there with you
Yeah,
to guide you and answer your questions.
like a team of expert navigators
Yes.
helping you through those rough waters.
Absolutely.
Love it.
So as we wrap up
Yeah.
this deep dive,
Mhm.
I want to leave you with something to think about.
All right, hit me with that thought-provoking question.
Okay, so imagine you're sitting down with your doctor and you have one more question about biopsies, just one.
Okay.
What would it be?
Ooh, that's a really good one.
Yeah.
It makes you think, what's important to me?
Exactly.
Like, what do I really need to know?
Exactly, because every journey is different, right?
Right, right.
Everyone has their own concerns, their own anxieties, their own questions.
Yeah, for sure.
And finding those answers can be so empowering.
Absolutely.
It's like you're taking control
Yeah.
of your own health.
You're not just being told what to do. You're part of the process.
Exactly.
Yeah, I like that.
It's about being proactive.
Okay.
Not passive.
So it's not just, okay, doc, tell me what's going on.
Right.
It's, okay, I need this information so I can make the best decision.
Exactly.
I think we've given our listeners a lot to think about today
I hope so.
about biopsies, from the technical stuff to the emotional and mental side of things.
Absolutely.
Yeah,
Remember, knowledge is power.
it really is.
The more you understand,
Mhm.
the better equipped you'll be
Yeah.
to go through this journey with confidence.
Couldn't have said it better myself.
Thanks.
To our listener, we wish you all the best on your path toward understanding and making those informed decisions.
Yes, absolutely. And until next time, stay curious, stay informed,
Keep diving deep.
keep diving